Diseases of the esophagus in dogs and cats. So the diseases are esophagitis, gastroesophageal reflux, foreign bodies, dysmotility, megaesophagus, spirocercosis, and persistent right aortic arch, and regurgitation versus vomiting. Esophagitis can be caused by substances, gastroesophageal reflux, foreign bodies, and medications and anesthesia. The signs are regurgitation, salivation, food refusal, and coughing. The treatment is omeprazole and sulcrafate and metoclopramide. In gastroesophageal reflux, the definition is stomach content reflux due to poor cardiac closure. The causes are delayed gastric emptying and anesthesia or hiatal hernia. The treatment is a low-fat diet, H2 blockers, and omeprazole, as well as prokinetics to stop the delayed gastric emptying and sulcrafate. In the case of foreign bodies, the sign is regurgitation, salivation, coughing, and dyspnea. The signs are radiography and endoscopy, and the treatment is endoscopic removal, surgery if needed. In dysmotility, the types are megaesophagus, partial dysmotility, and diverticulum. The signs are dysphagia, regurgitation, weight loss, and secondary bronchopneumonia. The treatment is upright feeding in a Bailey chair and to treat the underlying causes. In megaesophagus, decreased motility causes esophageal dilation. The types are congenital in the case of Schnauzers and Great Danes, and acquired in the case of Mystacia gravis. The treatment is upright feeding in a Bailey chair and sulcrafate, and give pyridostigmine in the case of Mystacia gravis. In spirocercosis, the cause is spirocerca lupi. It causes esophageal nodules and aortic aneurysms. The signs are regurgitation, weight loss, and sudden death. The treatment is moxidectin. For persistent right aortic arch, the definition is it's a congenital vascular ring abnormality compressing the esophagus. The diagnosis is contrast radiography and endoscopy, and the treatment is surgical correction. In regurgitation versus vomiting, in regurgitation, it's passive and there's undigested food and no bile. In vomiting, it's active and there's retching and there's digestive food and bile. Vomiting can be caused by metabolic problems such as renal and hepatic issues and electrolyte imbalances, or GDV and foreign bodies, or intestinal obstructions and parasites, or pancreatitis. The management of vomiting, so you can give antiemetics such as maropitant, and no food for 24 hours, and then afterwards you can give bland food, and then acid reducers such as omeprazole, and mucosal protectives such as sulcrafate.